outcome for every. And so we, that was just such a great opportunity for me to transition essentially from that world of child welfare over here to Humana to be able to continue that mission, if you will. But with Humana, Humana Healthy Horizons, we do a lot of work with vulnerable children and families, which kind of ties into that work that I did over there at DCF. So yeah, I'm really excited to be here. You didn't mention, but I myself have 2 children that are adults. One actually is on the autism spectrum, and one struggles with other mental illnesses and things like that. So I've got a little bit of lived experience there. So really excited to kind of talk through with you and kind of go from there.
Great, wonderful. Well, as we all know, 1 in 5 adults live with a mental illness in any given year. But now we're going to be looking at children, and mental illness, it doesn't care about your race, your gender, your socioeconomic, your age. So kind of throw some stats at you, then we'll kind of dive in. Approximately 50% of students ages 14 and older with a mental illness drop out of high school. It's the highest dropout rate of any disability. So that's pretty alarming. Also, 13% of youth ages 8 to 15 live with mental illness severe enough to cause significant impairment in their day-to-day lives. So that's a pretty big number. And, when I mentioned the word mental illness, here at NAMI, we use the word mental illness and mental health condition interchangeably. But we do know that there is a difference between mental health and mental illness or mental health conditions. So we'll start with that question, Lisa. If you can just, tell us, in your opinion, what is the difference between mental health and mental illness?
Yeah, it's a great question, Denise. And I think, I tend to default to mental health, when speaking in terms of that. When you talk about your mental health, that's basically looking at your day-to-day psychological well-being. It's about how we take care of ourselves mentally, emotionally, and just being able to cope with stress, handle challenges as they come our way, make sure that we're being productive and really just contributing in society in a way that, so that we have that sense of well-being. At Humana, we kind of look at 4 pillars, which is security, belonging, purpose, and then just our overall health. When it comes to children, we're talking about meeting their developmental milestones, learning the appropriate coping skills, learning how to cope with challenges and just deal with stressful situations as they come up, in social settings. So on the flip side of that, that's your mental health piece. So that's really about taking care of yourself. Mental illness is just actually a health condition that impacts our thoughts and our emotions. So, it's a disease, if you will, when you talk about diabetes or, heart disease and things like that. So that's where your mental illness comes in. It's going to meet specific criteria. Doctors are going to, kind of look at what your symptoms are, and they're going to go ahead and make a diagnosis off of that. So, it's not, when we talk about mental illness, it's not like today I feel sad and so I must have depression. You have to really, not meet those symptoms here and there, but where you're having it on a consistent basis. I think, it's really important to really know that, because I think we all feel a range of emotions, on different occasions. We're going to feel happiness, sadness, to extremes, but not necessarily like that becomes our norm and that's our level, if you will. That's at the point where it becomes a mental illness, where their symptoms are just so serious and so persistent that they're just not going away no matter what the conditions or the circumstances are. So that's how I think of it in terms of mental health versus mental illness.
Right. Yeah. And, when you touch on certain things, you talked about the way people deal with situations, and, you also mentioned about, identifying when somebody's going through a crisis, if they feel anxiety, if they feel stress. And I think, when we look at us as adults, I think for an adult, sometimes it's easier for adults to say, I'm having a bad day. I'm feeling off. I'm feeling stressed. I'm feeling anxious. I think I need to maybe reach out and get some help. But when we look at children and, the way they communicate, or sometimes lack of communicating, right, with an adult, with a parent, with a guardian, Do children have the same awareness about their own mental health the way adults do? And if not, what are some of the key differences?
Yeah, it's a good question. As adults, I would say we have that experience, if you will. We've had years to learn these things and to look at other people and look at ourselves and look at how we go through life, and to know when we're a little off, if you will, when things are just not feeling right, and when they don't feel right for a really long time. I think it's so much easier for us as adults. Children are still learning, especially when they're super young, maybe there's things that are affecting them and they can't communicate that to us because sometimes they don't know that it should be any different. So I think that, as we gain this knowledge, as we grow up and things like that, that's where, we can identify it. So for children, I think they're aware that they're, different, or that they feel things differently, or they experience things differently because they're talking to their friends and they're noticing that their friends don't notice these things the same way that they do. I think that, for children, they're a little bit at a disadvantage because of that, because they can't necessarily communicate it. I would say some of the key factors that we would be looking for, with the child is, we talk about the difference between signs and symptoms, right? Like, signs are things that I can observe in you. What are you doing that I can see? Symptoms are things that the child is experiencing. So I think that's where we really can start to figure out how that child is experiencing things, is based on kind of learning from them those signs and symptoms.
Right. And I think, it's also important that not just, parents are also, seeing a change in a behavior. And I know a lot of parents might question, is this a normal behavior for their age? But I think too, it's important that, the youth, teachers, and, coaches, and, school faculty, they also, I think, need to be educated and looking at the signs and symptoms, of a mental illness and mental health condition in youth. And I know here at NAMI, of course, I have to, plug our services too. NAMI does have a very good program called Ending the Silence. And we have that for children, middle and high school students. And we talk about, the signs and symptoms of a mental illness, and that it's very important to tell a trusted adult if they see something either in themselves or, with a friend, that they are to tell a trusted adult that, hey, something's not right. And then, definitely you have to have those lines of communication open. So I think that's very important. So with that, again, we talk about, is this just is my child just acting out? Is this a normal behavior for their age? But what are some of the common misconceptions that we assume about children and their mental health that are not true? Like, again, children, they don't have nothing to worry about. They're going to snap out of it. I think a lot of adults, again, it's just their age. It's normal for them to be this way. But can you talk about some of the common misconceptions about that?
Yeah, absolutely. And you kind of hit on some of them. I think, as adults, we're all guilty of kind of minimizing how children feel at times. I think, we live our lives, we're adults, we're in the adult world, and our lives are stressful. I'm trying to go out there and make enough money to take care of the household, and I'm trying to go out there and help you to get to your activities. And so I'm the one that should be stressed, and I'm the one that should be feeling this way. So I think it's really easy for us to kind of minimize that. With children, thinking like, how hard can it be? You guys just play video games all day. But I think that that's one thing that we really need to be aware of, is we should not minimize how they're feeling, and we should essentially just be there to support them and listen, and to understand that, their lives are complicated too, in a different sort of way. I know, especially in this generation, in this day and age, things are very different than when I grew up, 5 years ago. Just kidding. But yeah, I think that it's just important for us to be open to listening to them, and just really understanding that their perceptions are going to be different. They are growing up in a different time. They're growing up in the age of, electronics, and a lot of us didn't necessarily have electronics at our beck and call, even to just have a phone in your hand at all times to look down at it and be texting your friends and have everybody there at a moment's notice. So I do think that we need to take a step back and realize that the way that their lives are as growing up is going to be different than ours. And so kind of allow that everybody's experience is their own, and don't expect them to respond the same way necessarily as we did, or even the same way that an older or a younger sibling or a friend of theirs is. We have to realize they're all individuals, and that, you know, everybody has their own unique experience.
Very, very true. And you mentioned on two things about understanding and electronics. And I've been hearing more and more in our day-to-day the term comfort content when it comes to youth, meaning that, as adults, I think, it's easier for us to, I'm going to join a support group. So they take it upon themselves to join a support group, or realizing that, they're understanding, I need some help. I want to make an appointment to go to a counselor, to, go to see my doctor. But again, as children, they might not have that option. And so the word comfort content, I've been hearing more and more where kids are relying on electronics, Lisa, that you mentioned, to use, TV, gaming as a way of dealing with stress and anxiety. And, I always say that kind of has a double-edged sword, because a lot of times you hear that electronics can cause bullying, right? Which can cause more emotional distress on a child. But then on the flip side of it, this new comfort content, we're hearing more about that, and again, too, because of the pandemic, kids are reaching out in other ways to seek support and to help. And that they're using TV, they're using TikTok, where they can be more creative to help, and they're using gaming. So turning into this into a question then is, how does a child or an adolescent express mental distress that is different from an adult? And how can parents and caregivers be mindful of that process and offer support?
Yeah, and I love, bringing up the comfort content. Some people refer to it too as self-soothing, their ability to kind of take care of themselves, if you will. And we want that in a child, right? Like, we want them to be able to have those coping skills and those coping mechanisms. And if that mechanism does have to be a piece of electronics at this point, I think that's the generation that we're in. I think it's a balancing act. I think, as parents, and especially, I would say, if anybody on here has young children, start early with really putting in place some boundaries for that. I will say that my children, when they were young, that was kind of the early stages, if you will, of getting, electronics in their hands. And it was an exciting time, because we thought, these guys are going to be the future of computers, and we want them to be around computers because we want them to be able to have that as a career path, where it's expected that they're going to have computers in front of them all the time as they grow up. So I think that, just setting those boundaries in place from the early on is really important. And everybody's, again, experience will be different, but just how to set that up. I would say, in terms of, just being mindful of how they would express their mental distress and things like that, I would say that anytime that you notice your child is acting out of the norm for that child, it's worth taking note of. If they've got changes in friends, changes in school behaviors, even changes in how they interact at home. Again, everybody kind of has their baseline. I always think of it like that. And so when they, go up or down from what you're used to, and maybe it goes on for a longer period than maybe you're used to, I think we need to really take note of that and really start asking those questions of them. We want to, I feel like it's very important that we be open to listening. We're very good at giving advice. We're adults. We've been there. We've done that. But I think we have to learn to take a step back and just really listen to what the kids have to tell us, and then go from there. How can we help you? You want to look for things like they start isolating from the family. All of a sudden, they're just in their room all the time. And maybe before, they used to be in the living room playing their video games. Now they're taking their handheld consoles and going and just kind of isolating. You notice changes in their friendships. You notice that they're no longer hanging around with the friends they hung around with, or they're no longer going out, which I know a lot of kids don't always go outside anymore, but they're no longer going out to play basketball with their friends down the street. All of a sudden, they're not hanging around with anybody. They're the activities they used to just enjoy all the time, even as simple as you used to always read a book, and now I don't even see you ever with a book in your hand. All you're doing is just hanging around in your room, or just sitting on the couch. And those are the things I think we want to just notice, those changes in behaviors, and that's when we want to step in and act. We don't want to wait too long, because we want to get in there before things get worse, if they're really starting to have some problems.
Right. And so when we're talking about, starting to see some issues, in the beginning, I mentioned that, 13% of youth ages 8 to 15, live with a mental illness, severe enough to cause, an impact in their daily routine. But let's talk about that age, and really, when do we think, what's the norm of, what we're seeing, with how young, a mental illness can be detected. So, when does a youth begin to experience signs of a mental illness, and how can parents and teachers and caregivers give them the support that they need?
Yeah, it's such a hard question because it really depends on the condition, right? Like, you can see kids who show signs and symptoms of, as early as, elementary school, even sometimes before that, and not the most severe of conditions per se, but, a lot of kids are getting diagnosed with, attention deficit disorder, or ADHD, at, in elementary school at a very young age. That usually sometimes can trigger the initial, conditions, if you will, and then that may shift into something a little bit more, severe or more pressing in the long term. So, we have to keep in mind too that, as we talk about mental illnesses, mental health conditions, if you will, some of them can be pretty shorter term, and we can, I don't want to say nip it in the bud, but we can address the situation, and it can stabilize the child. Sometimes these conditions can last a lifetime, and we might see a little bit of up and down throughout the course of our lives. And so, you may have a child who exhibits certain symptoms and conditions, and he's, being treated for that condition and getting diagnosed, with that condition. And then it may stabilize, and then it may pop back up again as they get older in adults. So I think that the answer is, I don't know that there really is a cut and dry answer to it. I think, again, it's about just really being aware, and we don't really have a crystal ball to know what, if somebody's diagnosed with something, what that condition is going to be over the course of their lifetime. It may be something that just, maybe at age 10, they start to show signs of depression, and we address it, and it's situational, if you will, right? Like, we all go through things. And so if there's a situation, there's kind of trauma or grief, something in the family that's happening, and that allows, us to address that issue right then and there, and maybe then we're good, and we're not going to see this again in the child. But then there are those kids where it's recurrent. Maybe it is genetic, there are some genetic predispositions to these conditions. Maybe it's going to be a lifetime struggle for them. So I think we want to know that it could be a short-term or a long-term effect on them. The key is, though, that the earlier in the process that we intervene, I think the better outcomes that we're going to see.
Right. And I know here at NAMI, one of our strategic initiatives is, early prevention, early intervention. And we've also seen, we've heard from parents, and we've seen research that shows, sometimes the symptoms can begin at 8 years old, but also there's a lag, in parents getting treatment and help up until the age of 14. And I think, we always talk about stigma. We know that there is stigma around mental illness, and we can't get away from that. We are doing everything we can to break the stigma, but there is a stigma around it. And I know we have a lot of times, parents will call in, and the minute you mention the word mental illness or mental health condition, no, it's a behavior thing. And sometimes you have to change your language So the parents also feel comfortable in finding support for their child because they don't want to hear the word mental illness, mental health condition, because there is that stigma around that word. And I think, language is also, very important. But um, so again, going back to the language, we always say there's a common saying that kids are resilient. You take a child, you move them to a new city. They have to get into, oh, don't worry, they'll make friends. Kids are resilient. They're fine with change. But as we know, that really isn't the fact. There's a lot of children that, any little trauma, is very, it causes different behaviors, and trauma is different across the board. Everybody perceives trauma differently, and especially in a child. So when a child experiences a trauma, are there any long-term impacts?
Yeah, gosh, Denise, it's funny that you bring this up. We're doing a huge initiative here at Humana, around just trauma-informed care and just making sure that like all of our associates have that trauma-informed care training, and just making sure that, our providers are trauma-informed, because, it's very easy, I think, again, to overlook things because we just think, well, as a child, we'll get over it, right? There's that, get over it again. And what we found, though, with trauma is that, again, the impact can vary based on the extent, the length of, the time the trauma has occurred, the frequency, and the number of traumas. So the more traumatic events that a child suffers, even between the ages of 0 to 5 is what we see, is where we may see that long-term impact. And I want to say in terms of risk factors, because that's what they are, is every time there's a traumatic event with a child, that's a risk factor. It doesn't mean that's going to be a lifetime sentence for the child, but it does mean that those are risk factors that we need to take into consideration, and that, we're going to make sure that we surround them essentially with those protective factors that are going to build that resilience. So, you talked about children being resilient. So children are resilient, but a lot of that is based upon just their support system that's around them. And that determines their ability to bounce back and move through a situation with, a lesser impact. Being like a positive support system, whether it's in the school, the community, just having that foundation that's been built for the child. So we don't want to take for granted that, if a child has a traumatic experience at the age of 1, whatever it is, that child is immediately going to bounce back. I think that's where we just make sure that we're aware, we're listening, we're providing those support systems, and we're, again, getting at it, early intervention. And I appreciated you saying that, early intervention, early prevention, all of those things are so important. Because we do want to be very aware of when we're having these risk factors. And one thing you can, where I talk about you don't necessarily know the duration and things like that, is you can have 2 people in the exact same situation, and they may each have a different view of that outcome. And that really has to do with those protective factors that we talk about, and that resilience that we build in them. How do we help them? I think it's natural for us as parents to, we know we want to do the best for our kids. I think it's natural for us to second guess our decisions. But I think that the most important thing is, are we paying attention to what's going on? If we have any concerns, we need to, kind of elevate it. Let's not ignore it. Let's bring it to the attention of your providers. Let's bring you into a support group like NAMI. Let's, the stigma is a thing. I mean, I can talk about that forever. It is something that I think that, we are working on culturally around, even around the country, is working on that stigmatizing language, and working on people just understanding that when you talk about mental illness, it should be equivalent, I think, to any other illness that's out there. If I have diabetes, I can walk around and I can tell you I have diabetes and I'm not embarrassed about it. If I have schizophrenia, that's a little different, right? Because you might look at me a little, you might take a step back and think, whoa, are you, how are you going to react to me? So anyways, just saying, basically, I think that just being able to accept, where we are, and helping to be there for the child, listening to the child, helping to provide those supports, get them involved in activities that are positive activities. And by all means, if you know that, your child is being bullied, please don't minimize that. Don't walk away from it. Let's hit it head on and let's get the support in place.
Yeah, that's a great best practice. And I'm going to throw in a question, and it wasn't on our list, but I'm going to throw it out there because you were mentioning about, measuring risk factors. And I know, and I'm glad we have, some representation from JWB, they're, doing a pilot from ages 4 to 11, and they've implemented, the ACE. And so when you're talking about measuring risk factors, Lisa, can you maybe talk about what are some of the measurement tools that maybe pediatricians, counselors, are using to measure those risk factors, such as the ACE, the Adverse Childhood Experience?
Yeah, Denise, absolutely. Yeah, so there's several tools out there, but there was one that was developed by a few psychologists back in the late 90s. I want to say, I'm bad with timing, but it's called the Adverse Childhood Experience Survey. Basically, it's a list of 10 questions that asks, about a child's experiences. It covers things as simple, we'll say, as divorce to death, loss of a family member, incarceration of a family member, exposure to domestic violence, exposure to substance use, and divorce is in there, So, I mean, all of these things, each one of these items is an adverse childhood experience. They add those up over, the course of the child's life between, I believe it's from 0 to 5. You add those up and that gives you your ACE score. And that goes back to where I was talking earlier. That's your risk factor. So that's, the higher the ACE score, the higher the risk. So the more experiences that you've had in that childhood that are driving that, adverse childhood experiences that are driving that ACE score, the higher the score, then the higher the risk. And so that's why I say we want to get at it as quickly as we can. And we really want to help to drive that number down. So a lot of it is prevention. And then if we can't prevent it, then we get in there and we address it quickly, early and often, I like to say.
Right. And kind of circling back to the ACE, I've also heard some individuals also refer to it, it also needs to take into consideration not just childhood experience, but community experience. There's, no matter where a child lives, there's, different demographics, there's different situations. And, we think that, community too plays an important role too in somebody's overall mental health, what the child is experiencing within their community. Is there a lot of violence? Is there a food insecurity? And that can play right into an overall, mental health condition. So that's very interesting. So kind of as we wind up, a few more questions. We all know COVID-19 has impacted our mental health over, the past 14 months, and specifically for children. They couldn't play, they couldn't do sports, they couldn't see their friends, go to their, little birthday parties. But Lisa, what do you recommend parents and caregivers be on the lookout as we begin re-entering the pre or the post-pandemic life?
Yeah, I think, it's been such a rough year and a half for everybody, especially for kids. I think we don't realize, again, the impact that it has on children. I don't know that we'll know that impact until, years down the road. I think we might look back and be like, oh, that pandemic, that's when, I think we'll see as a society what that impact is going to be. I think, trying to get life back to as normal a pattern as we can at this point, get them back out there socializing, get them involved in activities. And at that point, then if you notice some behaviors, again, that seem a little odd for your child, or if you're around other children and you notice patterns in their behavior, please be a good citizen and, talk to the family members about it, but definitely talk to the child about it. And I would say definitely approach them in a non-judgmental way, but at the same time, let them know that you're listening. Just be there and listen. Family dinner is always a great time in my house. You wouldn't believe the conversations that come out of their mouths while we're sitting there and there's stuff in their mouth, food. Also, traveling in the car, it's always a good time. But, you know, if you don't know what to do, I would say the big thing to do is please include your child's healthcare providers. So if they, you know, go to their pediatrician, if they've already got a counselor in place, work with the counselor. You know, they're trained to essentially screen for those mental health issues. They can point you in the right direction. And the other thing I would say is, you know, use those resources that are available. You know, through NAMI, you know, Humana, you know, there's several websites and partnerships that we've been doing. We've got Far From Alone as a website that you guys can access. And I think you guys probably have some information you can share on that. You know, I think it's important too that we realize too that the ones that were hardest hit, you know, throughout the pandemic are those families who have been struggling with mental illness, whether it's their own mental illness as adults or mental illness with their children. And so we want to make sure that, you know, as a community, that we are just kind of wrapping our support around those families and giving them that support. That's what Far From Alone is really all about. It's just making sure that people know they're not alone out there. There's people out there that have experienced similar experiences, and if they haven't, they're certainly here to give you, just help you out.
Absolutely. I know here at NAMI too, we use that term. I know a lot of our providers on this call use that term, that you are not alone. And I think it is very important to have those conversations. I know now that I have an adult child, but when she was younger, I usually, no, I'll sign up for the carpool, because again, you get a group of girls in the back seat of your car, you learn a lot. It's like, I did not know that. And, you know, I know with our circle, we would always have, you know, the moms would come together. Have you heard this? Did they talk about that? And, you know, again, that communication is so important, whether you do it, you know, at the dinner table, you know, as you're doing, you know, your carpool, or even just, you know, one-on-one, you know, going for a walk and just talking about, you know, hey, how's your day? What's going on? You know, I think you always, as a parent or as a caregiver, you just need to inquire more, always digging just a little bit deeper to try to get that answer. So that was great. And again, you know, if anybody has any questions, please, you know, feel free to put that in the chat. If you have any comments, please put that, you know, in the chat. We will definitely address them. And then one final question. What is the one thing, Lisa, that you would recommend to a parent or caregiver to begin that conversation about mental health, mental wellness, mental illness? You know, we talked about sitting around the table in the car, but how do you even start that conversation?
Yeah, I think that's a great question. You know, I think you just ask, you know, how are you feeling? You know, are things going okay? And I think if you get an answer that's like, fine, you know, if you get your one word answer and you're not getting those details, I think, you know, delve a little deeper. You know, tell me what that means. You know, tell me what you're feeling now. How does this affect you? If you know they've been through something, how are you feeling about that? How can we help? You know, be open to listening to whatever they have to say. I mean, they may throw out some stuff that, like, our generation is like, oh no, there's no way that, you know, that just doesn't make sense. I think it's really easy to judge them and be like, that doesn't make sense. That's not how it goes. Don't assume that we know better just because we're adults. I mean, these guys are our future. Maybe their world is going to look differently than, you know, than ours. You know, but they know themselves better than we know. You know, we know them pretty well, but as our own children, they know themselves. They know what they're thinking. I think we just have to be willing to spend time with them and listen and just give that supportive environment. It's going to go a long way. Again, I can't say enough. Don't be afraid to ask for help. Please don't let that stigma get in the way. Reach out, find somebody, network with somebody. There's lots out there. I say start with you guys at NAMI, because you guys really have a great resource, and I would highly recommend it. At Humana, one thing I didn't mention is, you know, when I talk about we're a health care organization, right, more than insurance, we have care managers here at Humana. So if you happen to have Humana insurance, and I bet other insurance companies have it too, reach out, get yourself a care manager, let them help you guide through the process. And they're specialists in behavioral health, just like I am.
Yeah, wonderful. Thank you so much. I think that that's so important. And, you know, again, we mentioned stigma, but I think, you know, the youth also, I think, look to celebrities a lot, and more celebrities are also coming out about, you know, their mental illness. And I think that that's a little bit more of a comfort as well, you know, to the youth, like, oh, you know, Justin Bieber and Selena Gomez and Michael Phelps and, you know, Lady Gaga, the list goes on. And I think, you know, for youth to see celebrities talking about mental health, that hopefully it's making it a little bit more easier about mental health. And again, Humana, you have such, great programs. JWB, they are a wealth of information. I know they partnered up too with, community health centers, to do a pilot study in, looking at youth from 4 to 11, and really looking at their, their behavior and their overall mental wellness. And yeah, definitely start that conversation, talk to your kids about it, break that stigma down, and yeah, seek help. So thank you so much, Lisa, for being here today and to sharing your wisdom and knowledge when it comes to children and mental health. Thank you so much to Humana for being, a wonderful sponsor of these Lunch and Learns. And we'll kind of open it up to if anybody has any questions, or if you just want to, make a comment. So Gabriella, I'll let you kind of monitor that to see if we have any questions.
No questions so far.
Okay. Well, we do want to give you back, your time. Everybody is so busy during the day, but we do want to thank you all for coming and taking time to listen to this Lunch and Learn, our final, Lunch and Learn of the month, not of the year, but of the month. So I'm glad that we kind of wrapped up mental health by really focusing on the children. And as Lisa said, children are our future, and it's important to get that early intervention, early prevention. Talk about it, talk if you see there's a change in your student, also have that conversation with your caregiver, the pediatrician, with your school. Schools are winding down, summer, is here. I'm sure there's plenty of programs, especially with summer rec. Talk to the summer rec coaches, really keep that conversation going, keep your arms around that child. And again, they are not alone. You are not alone on your mental health journey. So thank you, Lisa. Thank you to Humana. Thank you to Molina Cares for sponsoring these Lunch and Learns. We thought this was fun. We thought it was great in information. And again, if you have any questions, feel free to put them in the chat. If not, feel free to reach out to Humana. Feel free to reach out to NAMI Pinellas for some information. We also have these wonderful books called Parents and Teachers as Allies. So we have a plethora of information that we are more than happy, if you're interested in getting your hands on some of these resources, please reach out to NAMI Pinellas. We'll be more than happy to send you that. Reach out to Humana. Again, Lisa, thank you so much. Thank you for everybody for taking time on your lunch hour to spend time with us. Most importantly, make sure that you too are also looking after your overall mental health. Step away from the computer, go outside, get some sun, get that 20 minutes of vitamin D. It's so important that you stay healthy so you can stay healthy for somebody that you take care of. So if there's no questions, we will end it at that, and you all can have 20 minutes of your day back. So again, thank you so much for joining us today, and stay well.
Thanks so much.